Cape Cod Broadcasting weaves the listening environments of 99.9 WQRC, Ocean 104.7, WFCC Classical 107.5, Cape Country 104, and CapeCon.com's website experience to reflect the lifestyles of the people who live, work, and play on Cape Cod. We hope that you enjoy this podcast.
Good morning. I'm Rob Woodard. This is Sunday Journal. Today I'm joined by Jerome Friedman. He is a licensed independent clinical social worker and therapist in Mashpee. He deals with people with substance abuse issues. Mr. Friedman says he is now seeing more patients with heroin addiction than he has seen in 20 years of practice. We will be discussing the heroin problem and what can be done about it. Well, good morning, Mr. Friedman. How are you today?
Good morning, Rob. I'm fine. How are you?
Fine, thanks. Let's start here, Mr. Friedman. What is it about humans that we seem to be drawn to substances that alter our consciousness? Why are we into this substance abuse?
Well, it's an age-old question, I guess, and the answer, I suppose, is complicated. But we're often trying to get to a better state. We're trying to feel well. We're trying to feel good in the world, and whether it's relieving pain, physical or psychiatric, emotional, etc., or for other reasons, we sometimes use chemicals, use drugs to achieve that. Often it's about diversion. I like to watch the Red Sox. It helps me feel better. But it depends on how they're playing, too, I suppose.
That's true. So you say that you're seeing more heroin problems now than you've seen in 20 years of practice. What sort of an increase is that? Where were we 20 years ago and where are we now?
Oh, it's flip-flopped appreciably. From when I began my practice, it was rare that someone would be seen for opiate dependence in injective drug use. I guess the answer to the question is that it's become that much more affordable. That when we were kids, when I was a kid, it was the outlier high school kid, maybe one in the high school who would be using heroin. And at this point, it's very affordable. It's much purer and much more available at parties. So kids, teenagers, middle adolescents on up will show up at a party on a Friday night and somebody will have some heroin. And the first kid will say, well, I'm not a junkie. I'm not going to use heroin. And somebody will suggest, well, if you just snort it, you're not going to be a junkie. Well, okay, I can try that given the peer pressure, et cetera. Well, after snorting it and having the effects of the heroin, after a couple of weekend parties, let's go on to the injectable drug use.
Right.
Is sometimes how it unfolds. It's as simple as that.
And would you say that it's the result of earlier experimentation or earlier use of substances, and they're just looking for the next level?
Often that's the case. There's a lot of controversy, of course, about marijuana today and sort of what lends itself to the next. But that's right. I think it's often sort of progressing, moving on up.
So when you say that you're treating more people with heroin addiction, what sort of numbers are we talking about in percentage of your practice? Ballpark.
Yeah, my practice. I like to call my practice a general practice, but I've had extensive experience in treating the addictive disorders. So about half of my practice is related either to the identified patient who's using alcohol or other drugs, or family members, which would be interesting to talk about a little bit too. Percentage-wise, I'd say it's about 50-50, whereas 20 years ago it was 10%.
Okay. And so what are some of the other common substances that you are finding people addicted to?
Well, alcohol, of course, is the granddaddy of them all, being the legal drug that it is, and being what it is in our culture and our society. It's accessible to every kid, and so that tends to be the case. Marijuana, of course, is that much more potent today than it's ever been. Is also an issue. Cocaine is not, on the radar as much at all, at least in my little world, whereas it had been. So there's some change there. The opiate pills, of course, are similar to heroin in that they're opiate-based pharmaceuticals taken by mouth pill form versus injected or snorted, as we say, for the heroin. And that's a big problem, too. A really big problem.
And what I'm hearing from law enforcement and other sources is that as the government is clamping down more and more on the prescription painkillers and other opiates, that the people who are addicted to those or who have a propensity to use those drugs are now turning to heroin because, as you say, it's cheaper and readily available.
I think that's true. I was happy to be asked to come on. I think one of the things I'd like to get to talk to is about prevention. because the supply side is always going to be the case.
Absolutely. We will definitely get to that. So how does someone end up in your office? Are they referred there by doctors or courts or?
A wide range, yes. Someone's internist, physician, word of mouth. There's a drug court in Barnstable that can refer folks. A wide range of referral sources, I guess is the best way. Attorneys, and so forth.
Okay, so people who recognize a problem in someone will refer them to your office, and then what is that initial process like when someone comes in and maybe they're reluctant to admit that they have a problem or something, or generally when they get to you, they say, okay, I've had enough and I've got to do something about this.
That's right. Well, there's a range, and I think you touched on it well. That is, often the case is people are showing up in my office in what I call the or else school of treatment planning. Right. Where the school has said, you clean up, sober up, or else you're out of school. You sober up, or else you lose this job, or else, or else, or else. So that's the nature of the disorder. Denial, which, the old corny joke is not a river in Egypt. Denial is the mainstay defense mechanism. We want to minimize and deny that this is a problem, whether it's alcohol or other drugs. And part of my work is to help motivate and manage people along a spectrum of change. So if people come in and say, I don't have a problem, I'm only here because the judge says I do and I have to be here, I say, well, okay, so here you are and you have to be here and I have to be here. How do you want to take advantage of it? How to sort of connect with people and help motivate them, that's the key word, around getting better and moving along this spectrum of change, as we call it.
And are you seeing younger patients when it comes specifically to heroin abuse, or is it you're seeing younger patients in general, people younger getting more into these drugs and things?
I am seeing younger patients, and of course that's really unfortunate because the adolescent brain is still growing and still developing. People are still learning about the world, learning about relationships, and so the younger the kid, the more potentially problematic it is. There are two basic indicators of the likelihood of somebody developing an addictive disorder. The second one is family of origin. If you have a genetic history of alcoholism or drug dependence, it puts you at some risk of developing it yourself. It doesn't mean you're going to, but it puts you at some risk. And the number one indicator for developing? Age of onset. So if you start drinking at age 12, the likelihood of developing a problem is much greater than if you start at 14. If you start at 14, it's much greater than if you were 16, and so forth. Sure. That's the number one indicator, and that's where the prevention piece comes in.
And is there an element in common in the people that you see? Are most of them have some sort of underlying issue that's a common denominator in why they choose or not choose maybe, but why they become addicted?
I don't think there is. There's an expression from Yale to jail. I mean, I think folks with family histories and age of onset notwithstanding, folks come in from all sort of walks of life and all socioeconomic situations.
And when you say younger and younger, how much younger are they getting?
I take care of a couple of 17-year-olds at this point, and that's unfortunate and sort of where we're at. The families, of course, are the folks who are heartbroken. The families are sort of bringing their kids in and saying, fix them. I'm tired of sleeping with my wallet under my pillow because, Johnny has stolen all of the family jewelry and is now trying to steal my cash. So it's very much a family problem. And it's one of the first questions I ask when a parent calls is, who's got the problem? Because Johnny may, be living under the roof and doing what he's doing or flopping in the house, and the parents who are sort of pulling their hair out. And then in those cases, I'll try to get everybody to come in as a family and talk about it.
And obviously that I wanted to move on to that. So what are some of the things that families can do? I know you wanted to start talking about prevention, but what effect is there on the family? Obviously there's a sense of mistrust and things of that nature.
Absolutely. And I think we sometimes go down one of two paths that can be problematic. One path is to put our heads in the sand, like the ostrich, and to, again, sort of minimize and deny this is a phase, this is a stage, he's going to be okay. That's not usually helpful or useful. And actually, as prom season approaches in the spring, you hear almost every year in some community where the parents have had the kids drinking in the cellar because it's safer. We know they're going to drink, so it's better for them to be in the basement, et cetera. Well, it's not. that's not okay. And, a colleague of mine has called that contributing to the delinquency of a minor.
Yeah, that colleague was probably in law enforcement.
But it's a problem. It's a mixed message. And who knows if the kid drinks so much that they have alcohol poisoning or wander out and drive away and has a crisis. We need to be clear and give a consistent message. So the putting one's head in the sand is one avenue that's a problem. And being the over-dictatorial parent, too. The screaming, you damn well better not, screaming at the kid. And that's going to blow right past the kid. You want to get to a place of having a little bit more of an adult dialogue. Even though the kid may be 14, 15, or 16, they're not 6, 7, or 8. And so you need to say, how are you going to handle it when somebody offers you a joint at school? How are you going to handle it when somebody offers you a beer at Friday night party? You sort of enter into more of a consultant role with your kid rather than, ignoring it, minimizing it, or making demands.
I'm Rob Woodard. This is Sunday Journal. Today I'm talking with Jerome Friedman. He is a licensed independent clinical social worker. He's a therapist in Mashpee, and we are talking about substance abuse issues as well as the heroin problem that is increasing here on Cape Cod. So back to the heroin. Now, I've also heard that the heroin is being treated with various chemicals to make it more powerful. Can you talk about some of the dangers there? And with regard to addiction, does that make it more attractive to an addict?
I think you're referring to fentanyl, which is a chemical or a drug that's sometimes mixed or matched with heroin, I don't know that it makes it more attractive to somebody who's using intravenous drugs, but the high, is that much more of a spike, that much easier to attain. There are medicines on the other side that we're using to help people with opiate blockers. Vivitrol, for example, is a medicine that we're now using more that we hadn't before. It blocks the benefits, if you will, blocks the high that an addict will have if using while on this injectable medicine that doctors can prescribe. Patients have the injection done once every 3 or 4 weeks. And we've had good results. We're using it in some of the jails now across the county. I know even in Barnstable, someone with an opiate problem about to be released from the county jail, wanting to get help and do things differently other than just being refrigerated in jail, come out and lend itself to a recovering lifestyle, can start with this injectable medicine in jail and then follow up outpatient in the community to hopefully continue being clean.
Right. Now, you counsel your patients about the elevator. What is that, and what sort of counseling method is that?
The elevator. Well, one reference that's generally used is you can stop the elevator at any floor on the way down. You don't need to crash and burn. You can come in with whatever's going on. You don't need to suffer more losses. So it's sort of a visual reference of being in an elevator and stopping at any floor on the way down and getting off and talking and doing things differently. So
before you fall on the floor or get in a car wreck or really destroy your life, if you recognize you have a problem, you need to get off on the floor and not go to the basement. Now, I know that you wanted to get to prevention. Obviously, if we could prevent more of this stuff, problems would obviously diminish as well. Yeah. What can we do when we see somebody maybe going down the wrong path or beginning or maybe attracted to a drug abuse?
Yeah, I think that's right. We want to try to create an environment where sort of asking questions and enabling somebody to ask for help in an easier way is more manageable. When I was a kid, there was a lot more stigma involved with asking for help and getting in to see someone like me. Fortunately, that stigma is way down, and it's a lot easier. But there are still many more things we can do. One idea, I guess, I would like to promote is if we can have our pediatricians screen our kids more routinely. Kids see their pediatricians at least once a year for a checkup. How can that be built in where a little brief assessment can be added to that screen so that if a youngster does have an issue going on at age 14, it can be ascertained right then and there by the authority, if you will, by the pediatrician who's an ally and a friend of the families. When
you say evaluated, the pediatrician should be asking more questions about these types of things?
There's a very simple screening instrument. If I could, I'll tell you what it is. It's a misspelled acronym called CRAFT. It was actually designed by a pediatrician in Boston at Children's Hospital, Dr. Knight. And CRAFT stands for, quickly, C is for car. Have you ever ridden in a car where the driver, including yourself, has been under the influence of alcohol or other drugs? R is relax. Do you use alcohol or other drugs to relax or fit in? Well, why is that an issue? Because at 14 or 15, if a youngster is using to relax or fit in, we want to... A is for alone, to use alcohol or other drugs alone. It's different than an adult coming home and having a beer after work alone. But if youngsters who are tied in one another, developmentally are using alone, that's a red flag. F is forget, right? Like the alcohol blackout. Have you ever drank so much that you forgot the night before? Well, that shows that you're using so much that the brain is actually being impacted in a very deleterious way. The other F is family or friends. I usually just say, do your friends worry about how much you're using? Because if your friends are worried about how much you're using, I heard of a story this week where a college friend called this guy's parents because he was worried about this guy's drinking. Mm-hmm. If friends are worried about it, then that's a red flag. And T is trouble with a capital T. Have you ever gotten into trouble because of your use of alcohol and other drugs? School, courts, etc. And people know what trouble with a capital T means.
Oh, sure they do.
Yeah.
We just have a couple of minutes left. What else do you want to get out there about how people can avoid getting into this situation? And really, when is it time to get help? Obviously, you just enunciated that with the craft.
Yeah.
But obviously, everyone has to make their own peace with themselves with regard to seeking treatment. What would your advice be to anyone listening that maybe has a problem and recognizes it?
Yeah, that's a good question, and this has been a nice opportunity to, shed a little bit more light on a very real problem that's not only on the Cape, but this is where we live and work. I guess it has to do with sort of taking a look at your own life and trying to measure what struggles that you have in school or in relationships. If you just sort of focus on your functioning a little bit, how are things going for you at school or work for an adult? How are things going for you in a functioning way? And does it have to do with your drinking and drugging? And if that's the case, it's easy enough to ask for help. You can ask your mom. You can ask. You can go to the internet and proceed that way, or your doctor. It's help is there, but the first step is to ask for a little bit of it.
Great. Thank you so much for joining me today.
My pleasure, Rob.
Today I was joined by Jerome Friedman. He is a licensed independent clinical social worker. He's a therapist in Mashpee, and he deals with people with substance abuse issues. We were discussing the drug problem here on Cape Cod. I'm Rob Woodard. This is Sunday Journal.
This podcast is a presentation of Cape Cod Broadcasting, which is solely responsible for its content. Thank you for listening. For more information, please visit us at capecodbroadcasting.com.